Hello everyone. Am I live? Am I back? Can you see me? Can you hear me? Give me a thumbs up in the chat box if I'm clearly visible, audible. I will start the lecture ahead. Give me a minute to confirm. Just a second. If I'm clearly visible, audible, I will start the lecture ahead. Okay. Yeah. I hope it's working. I hope it's working. Yes. So I welcome you all for this session also. A very good morning to all of you. I am Dr. Priyanka Sachdev here, and today I'm here to continue my series of bacteriology. As you all may be knowing, I have started bacteriology 2 days back. So I'm going to teach you bacteriology in a comparative manner. Till now, what we have covered, we have already covered Staph aureus, we have already covered Streptococcus pyogenes. In the last lecture, we have started Pneumococcus. We are in the middle of the Pneumococcus. So first we will continue Pneumococcus, finish Pneumococcus, and after that I will start with Neisseria. Are you people there? Give me a thumbs up in the chat box. I will start with the Neisseria after that. So first we will complete the Pneumococcus. So in the Pneumococcus, so let me revise. In the Pneumococcus, in the introduction, we have seen it is a type of Streptococcus only which shows alpha hemolysis, right? In the classification, there is no further classification of Pneumococcus. It is only one bacteria. Streptococcus pneumoniae is the other name given to it, but it occurs in pairs. It occurs in pairs. That's why known as Diplococcus, right? Now, in morphology, we have learned three things. What are the three things we have learned in morphology? It is capsulated but not spore forming, non-motile. We have seen the three mnemonics, applied the three mnemonics. We have seen it is coming in the mnemonic of capsule but not coming in the mnemonic of spore and motility. So that is about the morphology. Let me come on the culture. In the culture, we have studied two culture media, blood agar and liquid media. Blood agar, and what is the summary in blood agar? In blood agar, the summary is that normally it shows alpha hemolysis, but on increased incubation, it shows carom coin appearance. Carom coin appearance, also known as drawnut appearance. But on anaerobic incubation, it shows beta hemolysis. That is the summary on blood agar. In liquid media, there is only turbidity, granularity is there, nothing important. Let me come on the last thing which I have taught you in the last lecture is the biochemical reactions. Very important. I taught you 4 biochemical reactions. Can any one of you summarize the 4 biochemical reactions which I taught you in the last lecture? So the first biochemical reaction, what is the first biochemical reaction? There are 4 biochemical reactions I taught you. The first is the sugar fermentation. Lavanya, which is the main sugar here, which differentiate Pneumococcus from other Streptococcus. Pneumococcus is also a type of Streptococcus, but there is one sugar fermentation which differentiate Pneumococcus from other Streptococcus. The name of the sugar is inulin. So inulin is a sugar which is fermented only by Pneumococcus but not by other Streptococcus. So inulin fermentation is the first biochemical reaction that you must learn. जिस पे बहुत questions आते हैं, right? That is the first thing. The second is a special enzyme present inside the pneumococcus which causes the lysis of the pneumococcus. This test is known as bile solubility test. So pneumococcus has an enzyme. The name of the enzyme is amylase. Normally it is inactive. In presence of bile, it will become active. On activating, it will degrade the pneumococcus. It will degrade the cell wall of the pneumococcus and pneumococcus will dissolve in bile. So that is known as bile solubility test. Number 2. Number 3, optochain. Learn the chemical optochain. Optochain is a chemical. It is an antibiotic in presence of which pneumococcus cannot grow. Pneumococcus is sensitive for optochain. It differentiates pneumococcus from other streptococcus. Other streptococcus are not sensitive for optochain, but pneumococcus is sensitive for optochain. So that is known as optochain sensitivity test. We can take a filter paper of optochain. We can see the colonies are not growing around the filter paper and growing everywhere else. And the last one, it is catalase negative, oxidase negative, urease negative. So yeah, it is negative, but negative findings are important. You want to differentiate the pneumococcus from staphylococcus, so say it is catalase negative. You want to differentiate pneumococcus from Neisseria, so say it is oxidase negative. Again, you want to differentiate pneumococcus from staphylococcus, say urease negative, because staphylococcus is catalase positive and urease positive and Neisseria is oxidase positive. That's why saying this property is very important. So we have stopped there. Now I'm continuing from the antigenic structure. First, give me a thumbs up, Lavanya, others. Shivani, thank you for your comment. So give me a thumbs up first. You got my point? You got my point? Give me a thumbs up. Should I proceed? Okay. So this is the biochemical reactions we have already covered. I have already enumerated the inulin fermentation. Inulin is a sugar which differentiates pneumococcus from other streptococcus. Only acid formation, no gas formation. Bile solubility test. We have seen that pneumococcus has an enzyme. The name of the enzyme is amylase. In presence of bile, the amylase will become active. On activating, it will cause degradation of the peptidoglycan content of the cell wall of the bacteria. So bacteria will dissolve in the bile. Pneumococcus is soluble in bile, dissolve in bile. Other Streptococcus do not dissolve in bile. They don't have amylase. So you can prove it. You take a culture plate. On the culture plate, these are the colonies of the Pneumococcus. These are the colonies. You can see the alpha colonies, alpha hemolytic colonies on the blood agar. You put few drops. You put few drops of bile here, few drops of bile. So wherever you are putting the bile, you can see the colonies are dissolving. This is dissolution of the colony. The colony is dissolved. So that is known as bile solubility test. Typical diagram, right? It is catalase negative, oxidase negative, urease negative. So I have told you the mnemonics. This is the mnemonic for catalase positivity organism SSVE, and in this mnemonic, Pneumococcus is not coming. So it is catalase negative. You know which organisms are catalase positive. In the last lecture, I taught you. This is the mnemonic for oxidase positive organism. He loves painting. Very nice picture on building. He loves painting. Very nice picture on building. In this mnemonic also Pneumococcus is not coming. There are two P, but none of them is Pneumococcus. The first P is Pseudomonas. The second P is Posturella, but it is not Pneumococcus. So Pneumococcus is oxidase negative also. And the third urease positive organisms, KP succina CD ultimate hai. KP succina CD ultimate hai. You know the full form. In this also we have a P, but this P is Proteus. It is not Pneumococcus. So it is urease negative. So it is oxidase negative, catalase negative, urease negative. The last property is Optochain. As I have told you, Optochain is a chemical. The Pneumococcus cannot grow in presence of Optochain. So what basically you are doing, you are taking a blood agar. If you are trying to grow the colonies, the lawn culture, you will find the colonies everywhere of Pneumococcus. But now what you are doing, you are taking a filter paper. This filter paper is dipped in Optochain and you are putting the filter paper on the blood agar. So you will see the colonies everywhere except the zone around the Optochain. A 5 millimeter or 10 millimeter zone around the Optochain doesn't show any colony. This zone is known as zone of inhibition. This zone is known as zone of inhibition. Why? And rest everywhere you will get the colonies. Everywhere you will get the colonies. So in this zone, you are not getting the colonies. This is the zone of inhibition. Why colonies are not growing in this zone? Because of Optochain. The Pneumococcus is sensitive for Optochain. This is known as Optochain sensitivity test. It comes in the form of image-based question also. It can come in your exam. Give me a thumbs up if you got my point. Everyone give me a thumbs up. Can you see this is the Optochain? This is the filter paper dipped in Optochain. If you can appreciate, zoom it out in the, there is none of the colony growing in this zone. And around it, you can see multiple lawn culture. You can find colonies everywhere except this zone. Everyone give me a thumbs up. So that is the biochemical reaction. We have summarized and done the 4 biochemical reaction. Inulin fermentation, bile solubility, Optochain sensitivity, catalase negative, oxidase negative, urease negative. So that is the 4 biochemical properties we have summarized. Let me come on antigenic structure. Let me see. Yes, antigenic structure. In the antigenic structure, the most important thing, we have capsule. We have capsule. And below the capsule, we have cell wall. In the cell wall, we have some antigens on the cell wall. We have C polysaccharide antigen on the cell wall. We have M protein on the cell wall. But the capsule is important. So this is the diagram. So this is the cell wall of the bacteria, and around the cell wall there is a capsule. So this is the capsule. So capsule is important. It is a capsulated. Actually, this is not the diagram. This is the correct diagram. Around 2 bacteria there is one capsule. So around 2, draw 2 bacteria. Around 2 bacteria there is one capsule. This is the cell membrane of the bacteria, and this is the capsule. So capsule is important. Capsule is important, right? How to demonstrate capsule? I told you 2 ways to demonstrate the capsule around the Pneumococcus. Can anyone of you tell me the 2 ways? So first is capsular antigen. The capsule is very important. Based on capsule, we classify the Pneumococcus into 90 types. Based on capsular antigen, we divide the Pneumococcus into type 1, type 2, type 3, 4, 5, 6A, 6, 8. So multiple, total 90 types. So learn. So based on the capsule have a specific antigen. It is known as SSS, specific soluble substance, and it is antigenic. Based on that, we divide the bacteria into 90 different types, right? So please learn it. Please learn it because vaccine mein kaam aayega. I will tell you the vaccine for Pneumococcus also, right? There are 2 ways of demonstrating a capsule, right? The first way, okay, the most important is the Quillen reaction. What do you mean by Quillen reaction? I have told you already. So in Quillen reaction, what you are doing, you are taking the bacteria. These are the capsules of the bacteria. In each capsule, 2 bacteria are present. What you are basically doing, you are providing the antibody against the capsule, not antibody against the bacteria. Mind my words. I'm providing antisera, antibody against the capsule. So antigen antibody reactions will take place. Because of antigen antibody reactions, the capsule will swell. The capsule will swell and it will be visible after swallowing. So swallowed capsule is visible. This reaction is known as Quill-Lung reaction. It was discovered by a scientist Newfield. It's maybe MCQ. What is the principle of Quill-Lung reaction? It is a capsular swelling reaction. You are swelling the capsule of the pneumococcus. So in this reaction, we take a suspension of pneumococcus. We mix the suspension with a specific antisera against the capsule, right? After doing so, we put the dye. The dye is methylene blue. So after that, what will happen? The pneumococcus, the capsule around the pneumococcus will be swollen and it can be seen under the microscope. This reaction is known as Quill-Lung reaction. Give me a thumbs up. So that is a summary of the capsule. In the capsule, based on the capsule, there is an antigen in the capsule. The name of the capsule is SSS, specific soluble substance, SSS. Based on that, we divide the bacteria into 90 different types, right? And for seeing capsule, we use India ink preparation and we use Quill-Lung reaction. In Quill-Lung reaction, we swell the capsule using antibodies, right? Now coming on the cell wall, different antigens are present, so I'm not interested in that. I'm leaving that. Okay, so I would like to launch some polls based on the culture, based on the biochemical reactions, and based on the antigenic structure. Till now, we have learned the morphology, introduction, morphology, culture, biochemical reaction, and antigenic structures. After that, I'm going to teach you pathogenesis, lab diagnosis, treatment, and prevalence, prophylaxis. These four headings I'm going to teach you right now. But let me ask some questions to you before that. The first question is in front of you. Can you tell me the answer of the first question? Ronut colony is a characteristic feature of which bacteria? Drotsman colony. What is Drotsman colony? Drotsman colony is carom coin appearance. Who will tell me the answer? I've given you the clue also. Is it Streptococcus pyogenes? Or is it Streptococcus pneumoniae? Or is it Enterococcus? Or is it viridans? Streptococcus viridans. Yes, Lavanya, you are absolutely right. The correct answer is Streptococcus pneumoniae. So Drotsman colony is the carom coin appearance in which on blood agar, when we do the incubation of Streptococcus pneumoniae, we find many colonies. If we increase the timings of the incubation, there is a central depression in each colony around which concentric rings are formed. So this is looking like Drotsman or this is looking like carom coin. So this is known as Drotsman or carom coin appearance. Yes, Samir, RR, Lavanya, you all are right. Very good. The correct answer here is B. Absolutely right. So, oh, I'm sorry. I have written the incorrect answer. The correct answer is B. I'm correcting. Sorry for mistake. The correct answer is B. Right. Drotsman colony. Coming on the next question. Okay. Question is not very clearly visible. So I will read the question. Don't worry. Capsule of Streptococcus pneumoniae can be demonstrated by which method? I want to demonstrate the capsule of Streptococcus pneumoniae. The four options are in front of you. Can I demonstrate it with India ink? Can I demonstrate it with Quill-Lung reaction? Can I demonstrate with both of the above or none of the above? So the four options are in front of you. Who will tell me the correct answer? Please tell me the correct answer. What is the correct answer here? Who will tell me? So what you will like to say? India ink preparation, Quill-Lung, both or none? So no, Samir, not only B. Say C, no. It is both. Both. We can demonstrate capsule by two methods. Number one, negative stain. That is India ink preparation, and second is Quill-Lung reaction. So I will go with C. I will go with C. The correct answer here is C. You got my point? So we can demonstrate the capsule using negative ink also, in which we stain the background. So the capsule will be visible. So in the last lecture, I shown you the diagram of the India ink also, right? If you have attended my last lecture. Coming on the next question. The next question is in front of you. Yes, RR, you are absolutely right. Coming on the next question. So the next question is in front of you. Which of the following test is useful to identify Streptococcus pneumoniae? So specific test for Streptococcus pneumoniae. The four options are in front of you. Is it bile solubility test, which differentiate Pneumococcus from others? Is it inulin fermentation, which differentiate Pneumococcus from others? Is it Optochain sensitivity test, which differentiate Pneumococcus from others, or all of them? What do you like to say? Bile solubility, inulin fermentation, Optochain sensitivity, or all of them? What do you? So Lavanya, yes. Samir, yes. All. So all of the above is the answer, right? So these are the specific properties of the pneumococcus which differentiate pneumococcus from other bacteria. So go with D. Go with D. Yes, don't go with A. Samir, don't only go with A. Don't go with A. Bile solubility test is one of the tests which differentiate pneumococcus from others. But Optochain sensitivity and inulin fermentation is also specific for pneumococcus only. None of the other bacteria shows these tests. So go with D. All of the above is more correct answer. Right? Give me a thumbs up. Coming to the next question. This is the next question. Which of the following bacteria produce alpha hemolysis on blood agar? Alpha hemolysis on blood agar. Now see the options. Here one of the option contains Staphylococcus and the remaining two options contain Streptococcus. This is Streptococcus pyogenes and this is Pneumococcus. This is Streptococcus pneumoniae. So you tell me which of the following bacteria produce alpha hemolysis on blood agar? What you will say? Alpha hemolysis के लिए what you will say? Which of the following bacteria produces alpha hemolysis on blood agar? Yes. So alpha hemolysis, of course, definitely. The correct answer is C. It is shown by the Streptococcus pneumoniae. You may be knowing that how to approach gram-positive bacteria. So on this, again, we will revise the four types of the bacteria, right? We have four types of bacteria: gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative bacilli. I'm interested currently in gram-positive cocci. We have two gram-positive cocci, Staphylococcus and Streptococcus. How to differentiate between the two? Both of them are gram-positive cocci. So my next topic is how to approach gram-positive cocci. If you are getting a gram-positive cocci, how will you approach it? What is your approach? What is your approach? So your answer should be, ma'am, first we will apply a catalase test. The first test to be applied here in the approach is catalase. If it is catalase positive, it is Staphylococcus. And if it is catalase negative, it is Streptococcus. So that is the first test we are going to apply. If it is Streptococcus, the second test we are going to apply is blood agar. On blood agar, we will see the hemolysis on blood agar, whether it is alpha, whether it is beta, or whether it is gamma, right? Alpha hemolysis is shown by two Streptococcus, Streptococcus viridans and Streptococcus pneumoniae. Beta is shown by Streptococcus pyogenes and gamma is shown by Enterococcus, right? All of them are Streptococcus, right? Staphylococcus always show beta hemolysis. Now see the hemolysis. So see the options now. So after the slide, I'm showing you the options again. So see, Staphylococcus always showing beta, but Streptococcus can be showing alpha also, beta also, gamma also. Staphylococcus always show beta hemolysis. There is no alpha and gamma in Staphylococcus. But Streptococcus can be showing three type of hemolysis: alpha, beta, and gamma. Alpha is shown by two, Streptococcus viridans and Streptococcus pneumoniae. Beta is shown by Streptococcus pyogenes and gamma is shown by Enterococcus. Now see the question. Which of the following bacteria produce alpha hemolysis? I'm asking alpha. So Staphylococcus never show alpha. It always show beta, right? Now Streptococcus can show alpha also, beta also, gamma also. But Streptococcus pyogenes shows beta. Streptococcus pneumoniae along with viridians shows alpha. So correct answer is D. You got my point? So it is not all of the above. The correct answer is D. Everyone give me a thumbs up. Yes, RRNS, you are absolutely right. Everyone give me a thumbs up. The correct answer here is D. Okay. The next question. Which of the following features are of pneumococcus except? I am asking except. So which of the following is not a feature of pneumococcus? Your options are bile insolubility, optochain sensitivity, gram positivity, and encapsulated. Which of the following is not a feature? Yes, Samir, you are absolutely right. What about others? Lavanya, RRNS, anyone else who want to participate in answering? What is the correct answer? What is the correct answer? Yes. So which of the following is not a feature of pneumococcus? Yes, bile insolubility is not a feature of pneumococcus because pneumococcus are bile soluble. They are bile soluble. They are optochain sensitive. They are gram positive cocci, diplococci, and they are capsulated. The remaining three are the features. Yes, Sachin. The remaining three are the features, but bile insolubility is not a feature. Bile solubility is a feature. So Sachin, Lavanya, Samir, what is the reason of bile solubility? Tell me the name of the enzyme which is present inside the pneumococcus, which become active in presence of bile and it causing solubility of the bile. Do you know the name of that enzyme? RR. Anyone? Does anyone of you know the name of that enzyme? Question can come on any point. The knowledge should be complete. The concept should be complete. What's the name of that enzyme? The name of that enzyme is amylase. Amylase is an enzyme which is present in inactive form. But in presence of white bile, it become active. Right? Not urease, Samir. It is amylase. Right? Correct answer here is A. Anyways, the next question in front of you, just a second. Yeah. Quillen reaction is seen in. We do Quillen reaction for which bacteria? For which bacteria we do Quillen reaction? Group B Streptococcus, or Staphylococcus, or Pneumococcus, or Enterococcus? No, the question is very, very super simple, easy, and it is a very easy question, and everyone will be right, I guess. So Quillen reaction hota kya hai? It is done for, of course, you all are right, it is done for Pneumococcus. So what is Quillen reaction? Lavanya, what is Quillen reaction? What do you do in Quillen reaction? So in Quillen reaction, we take the Diplococcus, Pneumococcus. So in Pneumococcus, it is a Diplococcus having two bacteria shares a common capsule. So this is a capsule around two bacteria. We want to highlight the capsule. So what do? We take antibodies. This is the antigen on the capsule. This is the antigen on the capsule, not on the bacteria. Mind my words. It is the antigen on the capsule. So we are taking specific anti-sera or antibodies against the capsular antigen, so that antigen antibody reactions take place. Since the antigen antibody reaction is taking place in the capsule will swell. The capsule will swell and it can be seen under microscope. It can be because it is swelling. This reaction is known as Quillen reaction. Yes, Lavanya, it is antigen antibody reaction in the capsule, which we are doing by taking specific anti-sera or antibody against the capsular antigen. So that is important here. So that is Quillen reaction. So I have shown you the diagram also, right? The correct answer here is C. This is the next question in front of you. Streptococcus pneumoniae produce which type of hemolysis on blood agar? Alpha, beta, or gamma? Is it alpha? Is it beta? Is it gamma, or any of the above? So Streptococcus pneumoniae shows which type of hemolysis on blood agar. You may be knowing the classification of Streptococcus for answering this question. Streptococcus are classified based on hemolysis of blood agar. It is of three types. It is of three types: alpha, beta, gamma. What are the examples of alpha? In alpha, we have two examples: Streptococcus pneumoniae and Streptococcus viridans. Right? So pneumonia shows alpha. Pneumonia shows alpha. Don't go with D. Why you are saying any of the above RRNS? Answer is A. It is showing alpha hemolysis. Yeah, in anaerobic condition, alpha converts into beta. That is a separate thing. But normally it shows alpha. So give me a thumbs up. Everyone give me a thumbs up. The correct answer is A. Can you see the question? Those who are wrong, specially give me a thumbs up. Everyone. Yes, Lavanya. The correct answer here is A. I'm changing the question. Instead of Streptococcus pneumoniae, I'm asking Streptococcus viridans. What is your answer now? From the four options, what is your answer now? Streptococcus viridans के लिए क्या answer है? What is your answer now? The same answer. Streptococcus pneumoniae and viridans, both of them shows alpha. So answer is alpha. I'm again changing the question. Instead of viridans, I'm asking Streptococcus pyogenes. What is your answer now? I'm asking Streptococcus pyogenes. So you know Streptococcus pyogenes shows beta hemolysis. Your answer will become beta. If I'm changing the question and I'm asking for Enterococcus, your answer will become gamma. So gamma ka example hai entero. So you should learn the examples. So question can be asked on anything, right? Give me a thumbs up. Give me a thumbs up. Okay. The next very important point to be understood here is genetic variation. What do you mean by genetic variation? What do you mean by genetic variation? As I have told you that pneumococcus are capsulated. You know, pneumococcus are capsulated. And sometimes it is non-capsulated also. Okay, let me draw a pneumococcus. Pneumococcus, these are capsulated and these are non-capsulated. Let me draw the two type of the pneumococcus to explain you the concept. So these are capsulated pneumococcus, these are non-capsulated pneumococcus. Let me write it here. These one are capsulated and you can see these one are non-capsulated, right? Now the thing is that the capsulated one are known as smooth. These one are known as smooth because the capsule is providing smoothness. These one are known as smooth and the non-capsulated one are known as rough. Please learn the other names. The capsulated one are known as smooth and the non-capsulated one are known as rough. Now the point is that the capsulated one are virulent. They cause disease. The capsule is required for disease, for causing the pneumonia, for causing other diseases. Without capsule, they cannot cause pneumonia in humans. So the capsulated one are virulent and the non-capsulated one are avirulent. Avirulent, they do not cause disease. So what is the summary? We have two types of pneumococcus bacteria. What are the two types of pneumococcus bacteria? The one who is capsulated and the one who is non-capsulated. The one who is capsulated, the first one is the capsulated, the second one is the non-capsulated. So write down, this one is capsulated, this one is non-capsulated, right? Capsulated one is known as smooth one and the non-capsulated one is known as rough one, right? You can see the first one is the smooth, the smoothness is due to the capsule. The second one is the rough. Capsule is required for causing disease. So the capsulated one or the smooth one are virulent and non-capsulated one or rough one are avirulent. Give me a thumbs up if you got the basic. If you got this basic, my next question to all of you, can I do the conversion? Can I convert smooth to rough or can I convert rough to smooth? Can I do both? My answer is yes, we can do both. We can convert capsulated to non-capsulated and we can convert non-capsulated to capsulated also. So this is known as antigenic variation. This is known as antigenic variation. Yes. So let me teach you genetic variation or antigenic variation, right? So we can do this conversion. So we will talk about one by one, the two types of conversion. The first is can we convert smooth to rough? What do you mean by smooth to rough? Smooth means capsule is present. Smooth to rough. Smooth means capsule is present and rough means capsule is not present, non-capsulated. So can I convert capsulated form to non-capsulated form? If you want to convert capsulated form to non-capsulated form, the bacteria have to lose capsule. If the bacteria loses capsule, the capsulated form convert into non-capsulated form. How to do that? How to do that? We can do that by doing repeated subculture. The answer is repeated subculture. What do you mean by that? So take a blood agar or take multiple blood agars. Multiple means hundreds of them. Take multiple blood agars. On the first blood agar, take your specimen. In your specimen, this is the Pneumococcus bacteria and try to grow colonies here. So this is your primary culture, the first culture which you are growing from your specimen. The colonies will grow. From these colonies, take a small amount of bacteria and grow it here. So colonies will grow. This is your secondary. From this, try to grow here. From this, try to grow here. From this, try to grow here. From this, try to grow here, here. So this is the phenomenon is known as repeated subculture. You are forming many cultures from the primary culture. So first you are making a primary culture and then you are making the culture from the primary culture. So this is known as repeated subculture. If you repeat the process multiple times, several times, the bacteria will lose its capsule. Initially the capsule is present in the bacteria here. Here capsule is present, but if you do the repeat subculturing, in the end you will find that the bacteria are non-capsulated. The capsule is already lost. So the capsulated form can be converted to non-capsulated form by repeated subculture. The process is very easy. ये तो बहुत easy था. You got my point? So we can convert the smooth to rough. We can convert smooth means capsulated. We can convert smooth to rough. We can convert capsulated to non-capsulated. We can convert capsulated means virulent to avirulent. We can do this conversion. The meaning of all of them is same, virulent, because we have learned the capsulated one are the smooth one are the virulent one and the non-capsulated one are the rough one are the avirulent one. We can do this conversion. The meaning of all these is same. The meaning of all these is same by doing one thing. What is the answer? How we can do this conversion? We can do this conversion by repeated subculture. The answer is repeated subculture. Give me a thumbs up, Lavanya, RR, Samir, others. Give me a thumbs up if you got it. So the answer. Now the difficult one is the reverse. Reverse कैसे करोगे? Now the next question can, so ये तो हो गया. The answer is repeated subculture. On repeated subculture, a spontaneous mutant form will be formed that will lose the capsule. And that is. Now the reverse is more difficult. The reverse. Can I convert rough to smooth? Can I convert non-capsulated to capsulated one? Can I convert avirulent to virulent? Can I do this conversion, the reverse? The answer is again yes, but this is difficult. So for proving it, yes, we can also do. There's an experiment. It is done by a scientist known as Griffith. So let me explain you Griffith experiment. For doing this, you have to understand Griffith experiment. Now, it is difficult. I'm warning you, it is difficult. So let me teach you Griffith experiment to show you how we can convert rough to smooth. How we can convert the rough pneumococci which do not have capsule, but they start producing new capsule and they convert into smooth one. How does this transformation take place? How does? So for this, we will understand an experiment which is known as Griffith experiment. So see the Griffith experiment. Griffith have taken 4 mice, 4 चूहे लिए उसने. Can you see the 4 mouse? The 4 mouse are live. Griffith has taken 4 mouse, 1, 2, 3, 4. 4 cages, 4 पिंजरे में 4 mouse हैं, right? The 4 mouse are different 4 mouse, right? So what he has done, in the first mouse, he has injected. So can you see the 4 injections? He has taken 4 injections. So in the first mouse, he has injected live capsulated pneumococcus. Live capsulated. The live, capsulated one are virulent. The capsulated one are virulent. The capsulated one are the smooth one and they are virulent. Since they are virulent, the mice is dead. After few days, the mice is dead because it was, and if you take the blood out of the dead mice, you will find this. So you can see all of them are capsulated. And each of them contain 2 bacteria inside them. So you will say, ma'am, it fits. The situation is fitting. What you are injecting, you are getting that only. You have injected live capsulated one. So because the capsulated one are virulent, that's why mice is dead. It is causing disease in the mice. It is virulent now. It is capsulated. It is virulent. It will cause disease in the mice. So mice is dead. And if you are taking the blood, what you have injected, you are getting the same thing. You have injected live capsulated one. You are getting live capsulated one. You will say, ma'am, the situation is fitting. It is absolutely right. There is no confusion. Okay, situation 1 is right. Let me come on situation 2. Situation 2, case scenario 2. In the case scenario 2, what he has done, Griffith have injected live but non-capsulated. इनिशियली लाइव थे लेकिन कैप्सुलेटेड थे, अभी भी लाइव है बट नॉन कैप्सुलेटेड वन. नॉन कैप्सुलेटेड वन आर रफ वन. They are avirulent. They do not cause disease. So here mouse remain healthy. No disease, no death. Because it cannot cause disease. It cannot. And if you take the blood sample of this mice out, you will find only bacteria. So these are the bacteria. They do not have capsule over them. So is the situation fitting? You will say, ma'am, again the situation is fitting. You are putting live non-capsulated bacteria. Non-capsulated are avirulent. That's why mice is healthy. Avirulent will not cause disease in the mice. So mice is not dead. The mice is healthy. It is no death, no disease. It is fitting. And if we take the blood out, whatever you are injecting, you are getting the same thing here. You have injected live non-capsulated. In the blood also we get live non-capsulated. Give me a thumbs up. Till now any confusion? No. You will say, ma'am, absolutely all right. It's not any confusion. Whatever you are injecting, you are getting the same thing in the blood. And the mice is showing the same features. See the third thing. See the third. Third bhi theek hai. In the third, you are not putting live bacteria. You are putting inside heat killed bacteria, killed capsulated. I'm not putting live. I'm putting killed capsulated. Killed and capsulated. Capsulated one are the smooth one and they are virulent. But they are virulent only if they are live. Now they are killed, so they will not be virulent. Will the mice die in the situation? If we were putting live capsulated, the mice was dying. In the first situation, we were putting live. एक तो जिंदा थे, live थे और capsulated थे. So बहुत dangerous थे. The mice was dead. But in the third situation, we are putting again capsulated. The capsulated one are virulent. I know they are virulent, but this time they are not live. They are killed. They are killed. What will happen to the mice? What will happen? Will the mice die or do not die? I'm asking to you, Samir, Lavanya, RR, others. I'm asking to you, will the mice die or will it not die? I know the bacteria is virulent, but if the bacteria is dead, will it kill the mice? The bacteria is dead. डालने से पहले ही the bacteria is dead. Bacteria, yes, Samir. So mice is healthy. You will not find the mice is killed. The mice is absolutely healthy. And if you take the blood out of this mice, you will get nothing because the bacteria were killed now. The killed bacteria will not come in the blood. The killed bacteria are not coming in the blood. So the mice is healthy. So the three situations, you got it. If you got the three situations, then only I will come on the fourth situation. You got my point? So in the first situation, the mice is dead. In the second and third situation, the mice is healthy. Now in the fourth, you are combining second and third. You are giving two things inside it. You are giving two things inside it. Number one, you are giving live non-capsulated. That is live दिए लेकिन non-capsulated one और killed capsulated one. Killed capsulated one. तो क्या होना चाहिए according to you? According to you, what should happen? According to you, अगर हम सिर्फ live non-capsulated दे रहे हैं तो mice is healthy. और अगर हम सिर्फ killed non-encapsulated दे रहे हैं तो again mice is healthy. We are combining the two. The second and the third situation we are combining in one injection and putting inside. So यहाँ पे भी mice healthy है, यहाँ पे भी mice healthy है. So here also on combination we were expecting the mice should be healthy. But here on the contrary, the mice is dead. Oh my God. Why it is happening? The mice is dead. You got my point? The mice is dead. So what is the point here? What is the point? So here inside the injection, we are mixing the two and putting it inside. So here the live non-capsulated one converted into capsulated one. And that is causing the killing of the bacteria. That is transformation taking place inside the animal. Inside the animal. You got my point? Give me a thumbs up. So what are the four situations we are taking? You tell me what are the four situations we are taking? So we are taking four mice. Mice number 1, mice number 2, mice number 3, mice number 4. In the 4, first we are taking live bacteria. We are taking live bacteria. We are taking killed. And in the fourth, we are taking combination of live and killed. The second and third combination. Okay. I will again write in simplified form to explain you. These are the four experiments Griffith have done. I will come on that. What factor is transforming? So give me a minute. So in the first, we are taking live capsulated one. The capsulated one are the virulent. That's why the end result, what is the end result in the first experiment? In the first experiment, the mouse will be dead because the bacteria are live. The bacteria are live and they are capsulated one. So mouse will be dead. And in the blood, you will find live capsulated. In the blood, whatever you have injected, you are finding that only. In the second, you are putting live but non-capsulated. You are putting non-capsulated. Non-capsulated are avirulent. Non-capsulated are avirulent. So although they are live, but they are avirulent now. So mouse will be healthy. The mouse will not be dead. And in the blood, you will find the same thing. Live, non-capsulated. Whatever you are injecting, you are getting that only. Mind it. Huh? In the third experiment, you are putting killed capsulated. In the first, you are putting live capsulated. Here, you are putting killed capsulated. So I know capsulated one are virulent, but this time they are killed. They are not live. So they cannot kill the mouse. So on the contrary, the mouse is healthy. Still mouse is healthy. And whatever you are injecting, you will get the same thing in the blood, that is killed capsulated. You are getting killed capsulated. Everyone give me a thumbs up. Everyone give me a thumbs up. Everyone. The fourth experiment is the best experiment. Fourth. So what Griffith has done, Griffith has combined these two things together and put together in the injection. So he has taken live non-capsulated and killed capsulated together. So take the two things together. The live capsulated and killed, live non-capsulated and the killed capsulated. So second and third को combine कर दो. So what we were expecting, हम expect क्या कर रहे थे? Here alone, if we are putting live non-capsulated, the mouse is healthy. Alone we are putting kill capsulated, the mouse is healthy. We are putting the combinations, we were expecting the mice should be healthy. क्योंकि alone में तो था, लेकिन combination में the mice is dead. So that is the shocking experiment. So why the mice is dead? Why the mice is dead? None of them can prove the mice can be dead because you are putting non-capsulated one are live. Non-capsulated one cannot cause the disease. Although they are live, but they cannot cause the disease. They are avirulent. And the capsulated one can cause the disease, but they are killed. So they also cannot cause the disease. So if none of them alone cause the disease, in combination, why they are causing the disease? Because whenever we put them in combination, the non-capsulated one converted to capsulated one. Non-capsulated one converted. This process is known as transformation. And here in the blood, on the contrary, what you are getting here in the blood of the mice, you will get live capsulated one. You have not injected live capsulated one. You have injected live non-capsulated and killed capsulated. You got a combination of live capsulated in the blood. So that is transformation taking place. Everyone give me a thumbs up. Everyone give me a thumbs up if you got it. Everyone, you got my point. So that is the Griffith experiment. So what is actually, so in the fourth mice, you can see live capsulated one in the blood. So what you are injecting, you are getting some other thing in the blood. So transformation takes place. So the same thing is written. So actually what is happening, this is a bacteria. Let me draw a bacteria. This one is the Pneumococcus bacteria. This one is also a Pneumococcus bacteria. This one is capsulated. This one is non-capsulated, right? The capsulated one is the dead one. It is killed one. The capsulated one is the killed one. And the non-capsulated one is the live one, right? Now this one is the killed. So this is the nucleus. The nucleus contains the DNA. Let me draw the DNA. This is the DNA. So the killed one will lose its DNA. The killed one will lose. The DNA will leak out. The DNA will come out. And this DNA, the gene from the DNA, it will enter in the live one. It will enter in the live one. So this one, in the DNA, there is a gene for the capsule. This gene is present for capsule in this bacteria, but this gene is absent in this bacteria. So the gene for the capsule is transformed from the killed bacteria to the live bacteria. Now live bacteria got the gene for the capsule. So live bacteria will also start forming the capsule. This is how I can convert the capsulated one, the non-capsulated one to capsulated. Initially it was non-capsulated now, and now it got converted to capsulated because this got the gene from the dead bacteria. Give me a thumbs up. Everyone give me a thumbs up. So this is known as transformation and this is Griffith experiment. Everyone give me a thumbs up. Everyone. Let me come on the next point, the virulence factor. Can you tell me the name of the virulence factors? How many virulence factors are there? So the main virulence factor here is the capsule. Here the main virulence factor is the capsule, which is very important for the disease. We have seen the capsulated form are virulent and the non-capsulated form are avirulent. Have you got it? So the capsulated form are virulent. Capsule is very necessary for causing disease. Non-capsulated strains are avirulent. They do not cause disease. So that is the most important. There is a toxin also. The name of the toxin is Pneumolysin. Pneumolysin. It is also causing disease. It is also required for causing disease, right? So in the virulence factor, you mainly learn capsule and there is a toxin Pneumolysin. Pneumolysin. Right, that's it. Pathogenesis. Tell me the name of diseases caused by pneumococcus. How many diseases can be caused by the pneumococcus? Can you name them? There are 4 diseases caused by pneumococcus. Number 1, as the name indicates, pneumococci causes pneumonia. Pneumococci causes pneumonia. That's why it is known as pneumococci. Number 2, it causes meningitis also. Number 3, it causes bacteremia or septicemia also, and others. Pneumonia, it causes 2 types of pneumonia: lobar pneumonia and lobular pneumonia. Lobar pneumonia and bronchopneumonia or lobular pneumonia, right? So that is the diseases can be caused. Now I'm not going in detail. You may be knowing कि किसमें क्या symptoms होंगे, right? So lobar pneumonia adults में होगा. It can occur in children also. So which serotype is causing which pneumonia, right? Bronchopneumonia जो होगा वो as a secondary infection भी होगा उसमें, as a secondary infection after the viral होगा, or any serotype can produce bronchopneumonia, right? So the 2 types of pneumonia. Meningitis, it is the most serious cause. It is the most serious infection caused by pneumococcus. It is the second most common cause of meningitis after Neisseria meningitis. So meningitis mainly caused by Neisseria meningitis. Second most common cause of meningitis is pneumococci. So that is the thing. Septicemia can occur. Septicemia can occur. And others में तो ठीक है. Sinusitis है, otitis media है. So these are the diseases. So 4 diseases occurs by pneumococcus. You should know the name. Number 1, pneumonia. Number 2, meningitis. Number 3, septicemia and others. Others में otitis media and sinusitis. That's it. The 2 types of pneumonia both can occur, lobar and lobular. Give me a thumbs up. Give me a thumbs up. Coming on the lab diagnosis. Tell me the specimen, what you will offer to the lab. Tell me the specimen. कौन सा specimen दोगे? If the patient is having pneumonia, give sputum. If the patient is having meningitis, give CSF. In pneumonia, you can give pleural exudate also. And if the patient is having septicemia, you can give blood. So depends what is the disease. What is the disease? So depending on the disease, if the patient is having pneumonia, give sputum. If the patient is having meningitis, give CSF. If the patient is having bacteremia, give blood. So your specimen will vary according to the disease. Give me a thumbs up. Give me a thumbs up. Collection and transport. Okay, ठीक है. No, this thing is required. No transport medium is required. And in the lab diagnosis, you can do 6 things. Number 1, you do direct microscopy. What you will find in direct microscopy? You will find gram-positive cocci, diplococci, which are having capsule but no spore formation, no motility. That is the morphology. Culture, you already know blood culture. Blood पे क्या answer है? Normally you will get alpha hemolysis, but on anaerobic condition you will get beta hemolysis. On prolonged incubation you will get Karam-Coin or Drodsman appearance. So you know the summary, right? Biochemical reaction, the 4 important biochemical reaction you already know. What is the 4 important biochemical reaction? Inulin fermentation, optochain sensitivity, bile solubility, and catalase negative, oxidase negative, urease negative. These are the 4 important biochemical reaction you should prove in the laboratory. I'm not repeating all them. I've already taught you microscopy पे क्या होगा, gram positive cocci. Morphology पे क्या होगा, capsule present है but spore और motility नहीं है. Culture पे main एक ही culture है blood agar. Blood agar पे alpha भी मिलेगा, beta भी मिलेगा और Karam-Coin और Drodsman appearance भी मिलेगा. Biochemical reaction, you cannot afford missing the 4 biochemical reaction. Inulin fermentation, optochain sensitivity, bile solubility, and 3 things are negative: catalase negative, oxidase negative, urease negative. Serology में you will get antibodies, right? So let me show you. Direct microscopy में you know it is gram positive diplococci. Culture में blood agar. On blood agar you already know Drodsman appearance, Karam-Coin appearance, initially alpha, later on beta. So you know everything. You know the central ambulation. Biochemical reaction, the 4 biochemical reaction you already know. You already know. Serology में you will detect the capsule. Capsule के लिए there is Quill-Lung reaction. You will do Quill-Lung reaction. Animal pathogenicity में mice. You will inject it inside the mice and mice will die. That is Griffith experiment. You can do the Griffith experiment. You know it, right? And antibiotic sensitivity test may you can do the antibiotics. So these are the lab diagnosis. Nothing important. We have already read them. All of them we can understand them. We have already understood them. Give me a thumbs up. Everyone give me a thumbs up. Everyone give me a thumbs up. Everyone. So I guess I am done. The treatment. The drug of choice is penicillin. But if penicillin resistant strains are there, drug of choice is cephalosporin. So first drug of choice is penicillin for pneumococcus. If penicillin resistant strains are there, the drug of choice is cephalosporin. That's it. I am done with the lab diagnosis. I am done with the treatment. The last is prophylaxis. In the prophylaxis, a vaccine is available. For pneumococcus, vaccine is available. For pneumococcus, we have a vaccine. So who should get the vaccine? Now, how many types of pneumococcus are there? Based on capsule, 90 types of pneumococcus are there. In the capsule, there is an antigen. Based on that antigen, 90 different types of pneumococcus are present. Right? So the vaccine are of 2 types. The first vaccine is a polyvalent vaccine, which contains 23 types among the 90. 90 में से 23. Out of the 90, 23 are most commonly causing the disease. So among the 90, we have taken those 23 and we have created a vaccine for that. So that is known as polyvalent. The polyvalent vaccine is 23 type. 23 type, right? Capsular antigen of 23 most prevalent serotypes. So it is not line say 1 to 20. So 1 to 90 may say the one which frequently causes pneumonia, meningitis in humans. We have taken those strains and we have prepared vaccine combining all of them, right? Single dose is required for this vaccine. 90% protection is there and the effectivity is for 5 years. Every 5 years you have to repeat the dose. That is polyvalent vaccine, the first type of vaccine, right? Number second, contraindication. Don't give vaccine less than 2 years of age. बच्चों में नहीं देना है. Don't give it in children less than 2 years of age. And don't give this vaccine in person who are on immunosuppressive therapy or who have lymphoreticular malignancies like lymphomas. So that are the two contraindications. The second vaccine is a conjugate vaccine. It is a conjugate vaccine in which we give pneumococcal vaccine along with the diphtheria. So we give two vaccines together, pneumococcus and diphtheria together in one vaccine, right? Here in this vaccine, not 23, we have taken only 7 common serotypes which causes diseases in human. Out of the 90, total 90 में से हमने 7 लिए हैं conjugate में. तो 7 pneumococcus के लिए हैं और diphtheria लिया है साथ में. So that is a conjugate. Again, the contraindication less than 2 years में we cannot give this vaccine. Everyone give me a thumbs up. I guess I am done. You want me to summarize the complete chapter, pneumococcus? No, I wish if time allows me, I can give you the summary of all 3 chapters. Till now in a comparative analysis, जो मैंने yesterday I taught you streptococcus, a day before yesterday I taught you staphylococcus, and today I taught you pneumococcus, right? So I'm giving you the summary of the pneumococcus. Everyone give me a thumbs up. Everyone first give me a thumbs up. You tell me the introduction. In the introduction, there is no name of scientist. Write down it is a gram-positive cocci. It occurs in pairs. That's why it is known as diplococcus. Diplococcus, that's it. Classification, there is no classification of pneumococcus. Only one bacteria is there, Streptococcus pneumoniae. It is a type of Streptococcus only. Streptococcus pneumoniae, right? In the morphology, write down 3 things: capsule, spore, and motility. So capsule is present, but spores and motility are absent. Compare the morphology here. Here all 3 things were absent: capsule, spore, motility. Here also all 3 things were absent. But here capsule is present, spore and motility is absent. Give me a thumbs up. Come on the culture media. Who will tell me the summary of the culture media? Only one culture, blood agar. The summary is on blood agar. Blood agar pe it initially shows alpha hemolysis. On prolonged incubation, it shows carom coin appearance or Drotzman appearance, that is central lumbination with carom ki goti jaisa appearance, right? On anaerobic incubation, it will show beta hemolysis. That is the summary on the blood agar. Who will give me the summary of biochemical reaction? You cannot afford missing one of the 4 biochemical reactions. There are 4 biochemical reactions. First is inulin fermentation, which differentiates this pneumococcus from all other streptococcus. The second is optochain sensitivity, which differentiates pneumococcus from all other streptococcus. The third is the bile solubility, which differentiates pneumococcus from all other bacteria. And last is the 3 negativity: catalase negative, oxidase negative, urease negative. You know the positive kaun se hain. I've already taught you. In the antigenic structure, only capsule is important. For capsule, we do 2 things: Indian ink preparation and quill-lung reaction. I guess everyone knows it. Coming on the virulence factor maybe capsule is important. Based on capsule, we divide it into 90 different types. 90 different types. In the pathogenesis, it causes 4 diseases. What are the 4 diseases? Number 1, pneumonia. The 2 types of pneumonia, lobar and lobular. Number 2, meningitis. It is the second most common cause of meningitis after Neisseria. Number 3, septicemia, and number 4, others. Right? In the lab diagnosis, you will do all the tests. You know the various tests and specimen. Coming on the treatment, the first drug of choice is penicillin. If penicillin resistant strains are there, go with cephalosporin. Cephalosporin, that's it. In the prophylaxis, we have vaccines available with us. The 2 types of vaccines are available: polyvalent and conjugate. In polyvalent vaccine, we give 23 serotypes out of 90, which most commonly causes diseases in human. Single dose is required, intramuscular given, effectivity is 90% for 5 years. That's it. The second vaccine is conjugate vaccine, in which we give only 7 serotypes out of the 90, which causes diseases in human along with diphtheria. Again, single dose is required. Both vaccines are contraindicated less than 2 years of age. I am done. If any one of you have any doubt, even a slightest doubt, you are free to ask. Write down in the chat box. I have an eye on your chat. I can read your chat. Give me a thumbs up. Otherwise, everyone give me a thumbs up. Everyone. Samir, not 9, it is 7. 7 plus diphtheria. 7 of the serotypes along with diphtheria, not 9. Right? And yeah, the polyvalent is 23. You are right there. Everyone give me a thumbs up. Everyone gave me a thumbs up. Everyone means everyone. Should I proceed ahead? Okay. I should proceed ahead. We will do some polls on the pneumococcus and move to the next chapter. Right? Okay. The question is in front of you. The first question is in front of you. Streptococcus pneumoniae causes what? Causes which disease? What is the pathogenesis? Is it causes lobar pneumonia? Does it causes bronchopneumonia? Does it causes meningitis, or does it causes all of them? Will tell me the correct answer. Question is very easy. Yes, Samir, absolutely right. It causes all of them. It causes both type of pneumonia along with meningitis. So correct answer here is D. Then next question is in front of you. Okay, antigen, okay. This one. In a patient with orbital cellulitis, in the orbit the patient is having pus, we found a microorganism. The microorganism show greenish discoloration around the colonies. What do you mean by greenish discoloration? Greenish discoloration around the colonies is giving you a clue in the question. It is alpha hemolysis. Beta hemolysis give clear discoloration. Alpha gives greenish. So there is an organism which shows alpha hemolysis on blood agar, and the organism shows optochain sensitivity. So two clues are given to you in the question. Number one, optochain sensitivity, and number two, greenish coloration colonies around the colonies, that is alpha hemolysis. So are based on the two clues, what is your answer? What is your answer? So the four options are in front of you. You all are right. Of course, the correct answer here is pneumococcus. Everyone knows. My question to you, Samir, Lavanya, or others who are answering it, why it is not Streptococcus viridans? Streptococcus viridans also give alpha hemolysis. No? It will also give greenish discoloration around the colonies. But yeah, viridans will not give optochain sensitivity. Optochain sensitivity is something unique with pneumococcus only. That's why answer is D, not A. If out of the two clue, only first of the clue is given, that is greenish colonies, and optochain sensitivity is not given in the question, I cannot decide between A and D. So A and D will be two answers. If only greenish colony, you will say me. But along with greenish colonies, you are giving one more clue, optochain sensitivity. So my answer is D. Give me a thumbs up. Give me a thumbs up. So this is how beautiful questions are created, right? Draughtsman concentric rings on the blood culture are shown by which bacteria? Draughtsman. Draughtsman का diagram ये होता है. The colony shows a central depression, central ambonation with concentric rings. So this is Canham point appearance or Draughtsman concentric ring appearance. Yes, the answer is D, and you all are right. These all are your previous year question papers, which are already asked in various exams, which I am putting in the form of the polls in front of you. Everyone give me a thumbs up. Everyone. So the next question is in front of you. There is an infant. There is an infant having high grade fever. Oh my God. An infant having high grade fever with respiratory distress. Right. So maybe the infant may have pneumonia. So the pneumonia fits, having respiratory distress and fever. Right. At the time of presentation to the emergency room, the parents are bringing the infant to you in the emergency room. You are a doctor there. You have collected the sample from the blood. You have collected the sample from the sputum, from the blood, and sent for the blood culture to the laboratory. In the blood culture, the microbiologist is calling you and saying, you doctor, whatever sample you have sent to me, it is showing alpha hemolytic colonies on the blood agar. Right. On gram staining, these are gram positive cocci. The organism, now the clues, gather the clues. The first clue given, it is showing alpha hemolytic colonies. The second clue given, it is a gram positive cocci, right? No, and the third clue, it is causing respiratory distress, that is pneumonia in the infant. So three clues are given in the question. Now you want to confirm the suspected organism. You have something in your mind, the organism can be this. You want to confirm that. So which of the following agent the organism will be susceptible? Is it susceptible for bacitracin? Is it susceptible for novobiocin? Is it susceptible for optochain? Is it susceptible for oxacillin? So what is the answer? Yes, you all know the correct answer here is C. It is optochain sensitivity, because the organism here is pneumococcus. The organism here is pneumococcus based on all the clues, right? If the organism here, instead of pneumococcus, if you get a presentation of staphylococcus, your answer will become novobiocin. If it is Streptococcus pyogenes, your answer will become bacitracin. So various bacteria are sensitive for various chemicals or antibiotics. Here the organism is pneumococcus, that's why answer is C. You got my point? You got my point? Should I go to the next question? So the next question is in front of you. These are the big clinical questions which came in your exam, and these are a little bit difficult questions, difficult level. You can see the next question. Just a second. Okay. The next question is in front of you. A patient presents with signs of pneumonia. So the first clue given in the question is the pneumonia. Patient presents with pneumonia, right? The bacterium obtained from the sputum, you have taken a sputum. The bacteria is gram positive cocci, showing alpha hemolysis. On sheep agar means blood agar. right? Which of the following test will confirm your diagnosis? So you are given three clues. The first clue, it is a pneumonia, an organism which causes pneumonia. The second clue, it is a gram positive, not gram negative. It is a cocci, not bacilli, and it shows alpha hemolysis. It shows alpha hemolysis. So what is the answer? First, identify the organism. The organism is straightforward pneumococcus. It is fitting everywhere. Pneumococcus causes pneumonia also. It is gram positive also. It is cocci also, and it shows alpha hemolysis also. So the correct answer here is bile solubility. Bile solubility is the unique feature of pneumococcus. That's why, yes, the answer is A. Coagulase test will be unique test for Staphylococcus, right? Bacitracin will be for Streptococcus pyogenes. So correct answer here is A. You got my point? Give me a thumbs up if you are getting it. Give me a thumbs up if you are getting it. Coming to the next question. With the same question, thoda bahut difference hai. So these are all your previous year question because that's why I'm launching all one by one. A person presents with pneumonia. Person is having pneumonia. You have taken the sputum. You have sent it for culture. The bacteria was gram positive cocci in chains having alpha hemolysis. Right? So again, what is the confirming diagnosis, confirming test for the diagnosis? Of course, the answer will be B. It is optochain sensitivity. So in all the questions, first you have to come on a point that what is the organism. Then after coming, what is the diagnosis? What is the organism? You read the four options, the answer will be clear to you. You got my point? The next question is in front of you. Please read the question. Bile solubility test is used to what? Why we use this test? We want to differentiate Staphylococcus from Streptococcus in this test, or we want to differentiate group B Streptococcus from other Streptococcus, or we want to differentiate Pneumococcus from other Streptococcus, or we want to differentiate Streptococcus from Neisseria. What we want to differentiate in the bile solubility test? Bile solubility test में हम किस बैक्टीरिया को किससे differentiate कर रहे हैं basically? So who will tell me the correct answer? Sameer, Lavanya? Yes, Sameer, you are absolutely right. So we use bile solubility test to differentiate pneumococcus from rest all streptococcus. As I have told you, pneumococcus is also a streptococcus. We want to differentiate pneumococcus from other streptococcus based on this test. So the correct answer here is C. You got my point? Correct answer here is C. Give me a thumbs up. Give me a thumbs up. So the next question is in front of you. After splenectomy, most common infection occurs. So humans have a spleen. Okay, I forgot to tell you this point there. I'm telling you here. Humans have spleen. Humans have spleen. We all have spleen inside us, right? This is a spleen. So whenever in our blood any of the pneumococcus enter by mistake, so spleen will kill it. Spleen will kill it. So those organisms, all those humans who have spleen, there are less chances we have pneumococcal infection. But due to any reason, if spleen is not there, splenectomy is done due to any reason, there is a tumor in the spleen, there is some anemia, sickle cell anemia, or there is some trauma in the spleen is removed because of due some other reason. Now these persons are highly susceptible of having pneumococcal infection because spleen is removed. Now there is no one in the body to protect the person from the pneumococcus. So whenever a doctor removes spleen, इस person को vaccine, the pneumococcal vaccine, the polyvalent or the conjugate, दोनों में से एक vaccine देना compulsory है. So I am not vaccinated for pneumococcus, to be frank. Maybe you are also not vaccinated. Not everyone is. Are you vaccinated for pneumococcus? No, no one is. So only the person who are at high risk, that is splenectomy person or old age person, we give pneumococcal vaccine to them. Give me a thumbs up. Everyone give me a thumbs up. So what is the answer here? Now read the question. After splenectomy, most common infection occurs in the person. The answer is A. It is pneumococcus. Yes, the answer is A. So again, the next question is in front of you. Post splenectomy vaccine is in, the patient is in need of which vaccine? Compulsorily, you have to give one vaccine to the patient after splenectomy because the patient is at high risk of that infection. So what is the answer? Is it pneumococcal vaccine, rotavirus vaccine, MMR vaccine, or BCG vaccine? What is the answer? So correct answer here is A. After splenectomy, you compulsorily give pneumococcal vaccine to the person because the person is at having high risk of having pneumococcal infection. You got my point? The next question is in front of you. Yes, Lavanya, absolutely right. The next question is in front of you. Read the question. Which of the following statement about pneumococcus is false? You tell me which of the following is false. I'm asking a false statement. So capsules aid virulence. Capsule की वजह से virulence होता है. Is it true or false? Commonest cause of otitis media. Is it true or false? Causes mild form of meningitis. Is it true or false? Respiratory tract of the carriers is most important source of infection. Is it true or false? So who will tell me which among the following is false? Which among the following is false? I want to ask you which among the following is the false statement. Now, let me read one by one all the options again. Let me read. So capsule aids virulence, this is true. This one is true. Yes, this is the true. Capsule की वजह से virulence होता है. It is the commonest cause of otitis media, sinusitis. Yeah, this is also true. It do not cause mild form of meningitis. It causes severe form of meningitis, especially in infants. So this statement is wrong. And yeah, respiratory route carriers are the most common routes of the infection. Right? Okay. The next question is in front of you. Streptococcal pneumonia presents at. Okay, streptococcal pneumonia. Usually streptococcal pneumonia most common age क्या होता है? So it usually occurs in children. This pneumonia usually occurs in children. So answer is less than 5 years of age. The next question is in front of you. The 23 polyvalent pneumococcal vaccine is available in the market. This vaccine is recommended in all of the following person except to whom it is not recommended. Will you recommend this person in CSF leak? Will you recommend this person in chronic cardiac disease? Will you recommend this this vaccine in children less than 2 years of age? Or will you recommend it in nephrotic syndrome? We recommend this vaccine in all high risk patients. All high risk patients. So who among them are high risk? So yes, absolutely right. The correct answer here is C, because it is contraindicated in children less than 2 years of age. I already told you. But remaining 3 patients are high risk. CSF leak, cardiac disease, the kidney failure, these are high risk patients. So we recommend them to take pneumococcal vaccine. Give me a thumbs up. So correct answer here is C. You got my point? You got my point? The next question is in front of you. Pneumococcal vaccine is prepared from. Vaccine हम किससे prepared करते हैं? There are 2 types of vaccines available in the market now. The 23 polyvalent vaccine and the conjugate vaccine, which contain only 7 serotypes along with diphtheria. So we prepare it from what? Does we prepare it from cell surface antigen, or we prepare it from the capsular polysaccharide, or we prepare it from the exotoxin, or we prepare it from the M protein? The 23 types out of 90 or the 7 types out of 90 are the capsule ke types. So we prepare it from the various types of the capsule. Yes, Samir, absolutely right. The correct answer here is B. So the 90 types of the capsule may say either we take 23 most prevalent or we take 7 most prevalent. So correct answer here is B. Give me a thumbs up. Give me a thumbs up. So next question. Pneumococcus can be differentiated from all other streptococcus by which of the following test? By which of the following test? By which of the following test you will differentiate pneumococcus from all other streptococcus? Type of hemolysis, gram staining, growth characteristics, or bile solubility. Name one test which differentiate pneumococcus from all other streptococcus. Pneumococcus is also streptococcus, na? Yes, Samir, absolutely right. The correct answer here is bile solubility. So bile solubility is the only. Yeah, although alpha, beta, gamma है. So alpha दूसरे streptococcus में भी होता है. Alpha occurs in 2 streptococcus, Streptococcus pneumoniae and Streptococcus viridans. So how you will differentiate the two? It is the bile solubility which is shown only by pneumococcus and none of the other bacteria. So correct answer here is D. Yes, Lavanya. So I am done with pneumococcus. I am done. So till now we have covered all the important points about pneumococcus bacteria, that is Streptococcus pneumonia, along with all the MCQs, previous year question papers, theory, comparative table, everything. Do you have any doubt in this? Do you have any doubt? Till now we covered 3 bacteria. We have covered Staphylococcus, Streptococcus, and Pneumococcus. My next chapter is Neisseria. The 2 types of Neisseria, Neisseria meningitis and Neisseria gonorrhoeae. In short, this one is known as meningococcus. Meningococcus. And this one is known as gonococcus. Right, so I'm going to cover meningococcus and gonococcus in the next lecture, because here the time is limited. So tomorrow I will cover these 2 chapters. So these 2 chapters in one hour or in 1.5 hours, I will cover these 2 chapters tomorrow. So here I would like to stop. Thank you very much for being with me. I really enjoyed teaching you. Hopefully you have learned today. Do you learn today? Do you find this lecture useful? If you find this lecture useful, please don't forget to click on the like button in the comment box, and just a second. Don't forget to click on the like button in the comment box, and don't forget to share a comment in the feedback. Give me a minute. Okay. There are few announcements for you. Let me do those announcements, then you people can go. So thank you very much for being with me. And okay, on Unacademy, this is a free test calendar for April 2022. So in the next month, in this month and next month, we conduct free tests for the students. So starting from April 25, 26, 27, 28, 29, and 30, these all tests are free tests. I want all the students to participate in the free test. The tests are absolutely free. You can see your all India rank while participating in these tests. So please note down the calendar, take a snapshot of it, and note down the calendar when we are having which subject test. So see the schedule and at least participate in the test. The tests are free, but you require a code to participate in this. If you want to give this test on the Unacademy Learners app, go install Unacademy Learners app, go to the app and use code Sachdev10. Sachdev, Sachdev is my surname. Sachdev, Sachdev10 is the code. You can use this code to participate in this free test. That is the first announcement. All India mock test NEET PG 2022, Unacademy is conducting it again on 1st May. So please set reminder at 9 a.m. in the morning. You all have to participate in this test and see your All India rank. It is the benchmark for your performance with All India rank prediction. So please give the test. Again, the test is free. You all can participate in the test. The only thing you require a code to participate in this. The code is same, Sachdev10. Sachdev, Sachdev10. Right. The most important announcement for today. Instead, if you take the subscription today from 25th to 28th of April, instead of 10% discount, you will get 20% discount on all subscription. Whether plus, whether iconic, whether light. Whatever subscription you want to take. It's your choice. Instead of 10, you will get 20%. Your offer bar nahi aayega, right? So it is, rarely the team launched this offer only for few days. So offer is valid only for 4 days, 25th to 28th of the April. So please take advantage of this. And if you are thinking of taking off any of the subscription, either plus subscription, in which you will get only Unacademy lectures. In Iconic, along with Unacademy, you will get Prep Reader also. In Light, you will get the test series. In MBBS first year subscription, you will get subscription only for anatomy, physiology, and biochemistry, the first year batch of the MBBS. So whatever subscription you want to take, the various plans are in front of you. See the minimum, maximum plan, see the prices. So on all these prices, apply 20% discount. Flat 20% off if you apply my code before payment. So please note down the code. It is SACHDEV, Sachdev 10. Sachdev is my surname. Sachdev 10 is the code. For all these subscriptions, flat 20% off. So that is the thing. And once you take the subscription, either plus or iconic, you will be eligible for all the batches. You will be eligible for solving previous year question bank available on the Unacademy. You will be able to take the daily practice papers after the plus class. And this is a new batch we are going to launch on 27th of April, right? So FMG 2020, you will be eligible for this batch also by topmost educators of the countries, right? So we work as a team and we help the students to crack their exams and reach their goals, right? Thank you very much. So give us an opportunity, take the subscriptions and take the benefit of the best team available in the India, right? Not only in India, but throughout the globe. So that is the best team and the best material, best education we are trying to provide to the students for reaching their goals. Thank you very much. See you all tomorrow morning for microbiology. Right now, I'm having my next lecture. Let me announce my next lecture. My next lecture is after 15 minutes. After a break of 15 minutes at 10 a.m. sharp, I'm taking the free class. Where? Not on YouTube. The class is free, but the class is on Unacademy platform. What I'm going to teach in that free class? I'm going to teach you pharmacology there. In pharma, I am going to cover entire renal pharmacology today, that is diuretics. No one will teach you diuretics with such a simplicity, beauty, diagrams, mnemonics, flowcharts. So give me an opportunity, come on the platform and listen this diuretic episode 1, 2, 3 right now. It is a free class. Again, same code for unlocking it. The Sachdev10 is the code. You can unlock the free lecture using this code. Bye-bye and